Hello, welcome to the Family Medicine Sub-internship orientation. My name is Patricia Seymour. I'm the director for this rotation. We are doing video orientation because for whatever reason I'm unavailable on your first day, and I want to make sure you get all the same information that I give sub-interns when I meet with them personally. The Family Medicine Hospitalist rotation is a track that's been around for about a decade, but in this year, academic year 15 through 16, we are offering this alternative, which is a hybrid model of family medicine inpatient care. It includes time on the adult medicine service, as well as postpartum, maternal child health, labor and delivery services. The advantage is that you get to see great spectrum of clinical experiences. However, there is a lot of switching between services, and I want to make sure that you feel empowered enough to tell the residents and attendings you're working with when you need to move on to other tasks and other services. Our first sub-intern found it most helpful to carry the schedule along with him so that he could show the people he was working with what his to-do list was for the day, and to help him make those transitions when a medical student may not otherwise feel empowered to say, I have to stop this activity, I need to move on to the next one that's on my schedule for today. I think you'll enjoy it. It's a lot of work. The schedule is demanding, but there's a lot of benefit and a lot of rich experience to garner from it as well. So the first thing that I normally talk about during orientation is the schedule. Please review your schedule and make sure that there aren't any major conflicts. We do expect you to be here on time for sign out and to stay until your clinical tasks are completed and sign out occurs on whichever service you're involved in. That said, sometimes things come up. We've had snowstorms, family illnesses, your own illness. Please contact me if that's the case with as much warning as possible so I can let the people you're working with that day know whether or not you're going to be available clinically. That said, let's talk a little bit about the day-to-day schedule. So you were emailed a schedule that says which services, orientation, didactics you would be working on for that day. It is important that you try to adhere to the schedule. In the beginning, there are several afternoons that you may notice have an asterisk, and it says that there's time available for a prenatal visit. You will be given a prenatal OB list, either by myself by email, or it will be left with Tracy O'Donnell, the administrator for the Family Medicine Hospitalists, that lists patients who are term or near term during your rotation. It is our hope that you will join that patient and their prenatal provider at Queen Street for a prenatal visit. That way you may establish a relationship with them prior to meeting them on the labor and delivery or postpartum floor. And hopefully they'll allow you to be a little bit more engaged in their care. One of the patients that the first sub-intern met, it did work out successfully. He went to a prenatal visit, and then he was able to care for her when she came into the hospital for her hospital-based care for her pregnancy. So the person to contact is listed at the bottom of your schedule, the emailed schedule you have, which I believe is Nicole, and there is a direct line there, and you have the patient list either from myself or Tracy. So try to find some time that matches up with that free time in your schedule to do this prenatal visit. Your first day is completely inpatient medicine. You'll go through orientation both on the inpatient service, and then you'll spend some time rounding with the second rounder. This hospitalist is our non-teaching attending, meaning he's not working with the inpatient residents. He or she is not working with the inpatient residents, and will be focused only on you as well as their other clinical tasks and obligations. It's pretty open-ended structure on the inpatient side. Normally that inpatient attending needs to do cardiac stress testing as well as see some uncovered patients, and you guys will meet up after you are done your postpartum rounds on the days where postpartum rounds are listed on your schedule. That's usually around 10:30. That will give you time to look at clinical information on the computer, gather vitals, maybe talk to the nurse, but at the very least, read the nursing notes for your patient so that you're prepared to present them in a formal way on bedside rounds between 10:30 and 1:30. Notes need to be done by 2 p.m. and your hospitalist attending should be giving you feedback about that. At least 1 or 2 notes per week should be discussed in detail, particularly early on in the rotation. You should be present on the days your schedule says this for a hospitalist sign out in the Jaquith office, which is the fourth door on the left. That usually happens sometime between 7 and 7:20 in the morning. Feel free to use one of the computers in that room while you're awaiting sign out on your patients. We want you to carry 2 or 3 patients on the adult inpatient service. On the postpartum service, where you'll be spending time rounding on moms and babies, you'll be working with the health center chief, one of our most senior residents, a third-year resident from the Queen Street Health Center. There are many mom-baby services in family medicine at Memorial Hospital. This is only one service, so they have an average daily census between 2 and 10 mom-baby pairs. You should follow as continuously as possible 1 to 2 of these mom-baby pairs, round on them, present them to the health center chief, and write the notes for that patient. The health center chief in this situation will give you feedback on those notes. Some days you'll be returning to the family medicine inpatient service after postpartum rounds, and some days you'll be staying on the maternal child health rotation. Most Tuesdays and Fridays, you're going to join us for didactics on the family medicine inpatient service, and that's in the South 6 conference room. On Tuesdays, there are several hours of maternal child health didactics where you'll cover postpartum, mom, baby, newborn topics, as well as labor and delivery topics. There is a project for this rotation. You are expected to complete 2 presentations. The first is an inpatient topic that has been of clinical interest to you that has not been done recently. Please clear that topic with me by your second week. It's 20 minutes. The target audience are the residents here that are on service, and most students have done this in PowerPoint format. This second project is dictated by the maternal child health rotation director. That is in a period of transition, so I can't tell you who that is. It's previously Ginny Van Dyne. It's going to be taken over by somebody else in the next month or so of August. That is similarly a 20-minute PowerPoint presentation to be given to residents about a newborn, labor and delivery, or postpartum topic that is of interest. Again, that topic should be cleared with the maternal child health director. We do expect you, for all your patients, moms, babies, laboring patients, adult inpatients, to really act like the intern. Write the orders, do the presentations on rounds, guide most of the discussions with the patient and the family members, do the discharge follow-up and discharge planning, in addition to making appointments as necessary. Please use Blackboard for a suggested list of readings and PowerPoints. You'll see there are medical topics and maternal child health topics listed by week. This is a guideline. I don't check up on this. These are the topics that I would expect you to be comfortable with by the end of the rotation. Please make sure you do your UMEDS. This is an LCME requirement for the medical school, and we are penalized when that does not occur. We do sit down and have end-of-block and mid-block evaluations face-to-face. I collect data from the different people you've worked with, and I look for feedback from you on the rotation so far. There are forms for this mid-block and end-of-block feedback on the Blackboard site that I do expect you to print up and sort of be ready to discuss the items there. At the bottom of the feedback form are certain elements of the UMass-wide sub-internship curriculum that we have to integrate, and I think that's a good opportunity for us to sit down and have face-to-face conversations about that. So please take a look at that. Finally, Tracy O'Donnell, who you may be scheduled to meet with, but if not, is available on the global email. She is the Family Medicine Hospitalist Coordinator and very helpful to me on site here at Memorial. She can give you information about IDs, badging, access to South 6 and the newborn nursery and the labor and delivery floor, parking, and how to get access to the scrubs and the scrub machine on the 4th floor, which is something you will need with this rotation. In terms of computer access, you do need access to most of the clinical programs we have available. SALAR, which is also known as Team Notes, is the note writing program that we use for the adult inpatient service. Orient tracks clinical data, nursing data. QMI, which is also known as perinatal centricity. You need Memorial Pulse Check access, which is the emergency room program. You need ImageCast access, and you also should have access to Allscripts for prescription information and other background information for the outpatients who are coming to us from the outpatient world. please check that you have access to all of these before your first day. If you need to call IS, the number is 508-334-8800 for the clinical side. Let them know who you are, and if you still don't have access, please be sure you've made this phone call first. I can request it for you, but I do need an email with the last 4 of your Social Security number in order to ask for that access. I can be reached almost any time of day. Even when I'm away on vacation, I have my cell phone with me, and my contact information is cell phone 774-364-0850. That or emailing is the preferred method of communication for me. Additionally, the residents on service that you might work with in the maternal child health, or the maternal child health director, or any of the family medicine hospitalists have worked with sub-interns on the service for years. They may be less familiar with this new piloted model that we're working on, but are a good first step if I'm not immediately available to you. All right, good luck, have fun. Again, this new hybrid model is a work in progress, but we've heard good stuff so far, and I think you'll find it interesting from a clinical and personal standpoint. Thanks so much.